I'm Rachel McCormack. I'm the founder of Societi, the UK Foundation for Kawasaki disease. Kawasaki disease is the leading cause of acquired heart disease in children in the UK. There'll be 1,000 children admitted to hospital with Kawasaki disease this year. It's increasingly common. We don't know why, we don't know what causes it, and lots of parents, lots of doctors have never heard of it. It's really important that they know Kawasaki disease because early treatment, early diagnosis, early treatment are absolutely essential to reducing the risk of lifelong heart disease. Over the last few weeks, you might have heard Kawasaki disease because it's been hitting the headlines. At least the term Kawasaki-like certainly has. This is a really unhelpful term. It's caused lots of confusion. And I've learned in the last few weeks that it's really easy to frighten people. It's much less easy to find out facts. And because parents like me want facts so they can make up their own minds about what's going on, my charity's done some work with experts, with doctors, to answer questions that families contacting us have raised. It's been really worrying for me to see the mishandling of information about paediatric inflammatory multisystem syndrome, or PIMS, which I'm sure you'll have heard of. I'm frustrated, like many in our community, that it's been so casually described as Kawasaki-like. That's done nothing but create more confusion. Kawasaki disease is often misdiagnosed at first because it's got symptoms in common with many illnesses. So the phrase Kawasaki-like is just unhelpful. It might as well have been measles-like or sepsis-like. These are equally uninformative phrases. Choosing the correct words at times like these is actually really important. The terms that have been used and the headlines that have followed have caused alarm. They've caused panic and fear for parents of young children and past patients. And what's really worrying is that these headlines have also confused doctors. Children actually affected by Kawasaki disease are potentially more at risk because of the confusion caused, since they may not receive the treatment for Kawasaki disease that they urgently need due to concerns that it might be COVID-19 or as a result of delayed presentation to hospital, because parents very understandably are worried about taking their children into hospitals, having heard about this serious disease. As a result, children with Kawasaki disease might not get that diagnosis and treatment that they need. The result of that is potentially lifelong heart damage. Providing clear facts has been my focus right from starting our charity in 2015. So I'm absolutely delighted to introduce Professor Paul Brogan from Great Ormond Street Hospital, who's a member of the Scientific Advisory Board for Society. Paul Brogan is a professor of vasculitis. For vasculitis, read inflammation. Arguably, in the UK, there's absolutely nobody better placed to speak about the confusion that's been caused around paediatric inflammatory multisystem syndrome. Over to you, Paul.
PIMS-TS stands for Paediatric Inflammatory Multisystem Syndrome, temporally related to SARS-CoV-2. So you can see why, as doctors, have tried to abbreviate that a little bit. It's a bit of a mouthful. It seems to be a delayed immune reaction triggered by the COVID-19 illness in a very small number of children. That's not directly at the moment related to the infection, but seems to be the body's reaction to that infection, creating an inflammatory response. This inflammation is rather non-specific in its presentation, but does seem to be temporarily related to the COVID-19 infection. But I emphasize again, just affects a very small minority of children so far.
And the word temporarily, that means associated in time, does it?
Yeah, it's a little bit confusing again, because you could argue that all diseases that children develop at the moment are in some way temporarily in time related to COVID-19, because we are all within this pandemic. However, the idea is that there is at least some evidence of being exposed to the virus. It might be from a nose swab test, or from the blood test of the antibody, the ever had test, or it might even be that you have been exposed to the virus because a family member has had the infection, so a history of it. So one curious thing about this entity is that the definitions that doctors are beginning to formulate don't even require definite proof that you have actually been infected. It just seems that you have been in some way exposed to it, either by history or by laboratory evidence, as well as symptoms.
Okay. There's been a lot of focus on children. Does this disease only affect children?
Well, here's the thing. I don't think that this is unique to children. We have known right from the beginning of this pandemic that adults develop a very severe inflammatory illness, sometimes referred to as the cytokine storm. So I was somewhat surprised when it was being badged as a new inflammatory process in children, because to me, it seemed very similar to the illness that's presenting in adults as well, with one or two subtle differences, as there always is across the age groups. But I think the pathogenesis, in other words, the way that the body reacts, is probably going to turn out to be rather similar in children and adults.
Okay, and we've heard a lot about this being a Kawasaki-like disease, and I don't like that phrase because I don't think it's very helpful. And we know too that it's a bit different from Kawasaki disease. So how is it different?
Yeah, it's caused a lot of confusion amongst doctors, but perhaps more importantly, use of this term in a rather loose way has caused an incredible amount of anxiety amongst patients. Patients who currently have well children but are worried about developing this terrible Kawasaki-like syndrome that they've looked up and on the internet and have become worried about, or even children who had Kawasaki disease years ago and are completely well and recovered. Are they in some way more at risk of developing a terrible complication from this coronavirus? And these are understandable worries for patients. But really what we're beginning to see in our practice is that this is a distinct entity that creates inflammation within the body, and indeed can cause many organs to be under stress, even some organs to fail and require intensive care, including the heart. But the nature of the heart involvement is rather distinct from Kawasaki disease. The problem that you have is that when you have other inflammatory illnesses presenting in the COVID era, invariably there's going to be confusion, because these are rare diseases that traditionally, even without the COVID crisis, created diagnostic confusion amongst doctors to begin with. So it's not surprising that there's even more diagnostic confusion at the moment. But to be very clear, I regard this PIMS-TS to be rather distinct clinically from Kawasaki disease and not the same.
Kawasaki disease, we know, is quite a serious disease, and there's been a lot talked about in terms of the potential serious effects of PIMS-TS. But actually, Kawasaki disease in itself is a pretty serious disease, isn't it?
It's a great mimic. It looks like a viral infection in children, often is misdiagnosed as that. And it's one of the great mysteries in pediatrics. What is the cause of this illness? And the reason that it's important is that it looks like a virus, almost like measles, with red eyes and a skin rash and very irritable, febrile children. But for some reason that we don't understand, the inflammation can attack the heart, specifically the coronary arteries. And this results in damage to those coronary arteries that can set the scene for permanent damage throughout that child's life. And the important point of thinking about Kawasaki disease is that if you think about the diagnosis, there are good treatments that can prevent that irreversible damage. So it's very important that doctors and patients understand that it's important to make an early diagnosis of Kawasaki disease even during the COVID pandemic.
And thinking about the difference in the symptoms and the presentation of Kawasaki disease, there's things like respiratory symptoms and a cough that you wouldn't see in Kawasaki disease, but you do appear to see in the new PIMS disease. What other things are different?
Yeah, so the PIMS-TS, cough may be present, particularly if there's been a respiratory component to the COVID. One of the curious things that we are seeing is gastrointestinal symptoms, so tummy pain, almost mimicking appendicitis. Sometimes there can be diarrhea, sometimes vomiting. In very rare cases of Kawasaki disease, you can see similar presentations, but it seems to be much more disproportionately represented in the PIMS-TS patients. So gastrointestinal involvement seems seems to be an emerging clinical feature. The other thing that we're seeing is abnormalities of blood clotting, uh, uh, which can include abnormalities on the blood test, but also clots themselves within arteries and within veins. And again, that's also being seen in adults. The other thing that we're seeing is just profound shock in this PIMS-TS, in other words, low blood pressure, the beginnings of heart failure. If you do an ultrasound or echocardiogram of the heart's not pumping properly. And again, that can happen in Kawasaki disease, but is the exception rather than the rule. So it seems there's a disproportionate number of these children who present with bad inflammation, sometimes with chest symptoms, often with tummy pain and inflammation in their body, and it seems rather different from Kawasaki disease. One other important difference that we're watching very closely is that this propensity to affect the coronary arteries is not such a common feature of PIMS-TS. The heart can be affected, as I've mentioned, but not so much this specific damage to the coronary arteries. And if you do see that, you should think Kawasaki disease rather than PIMS-TS.
So given those pretty clear differences, and I appreciate in a clinical environment there isn't always sharp clarity, and I know Kawasaki disease, for example, the symptoms that we've talked about for Kawasaki disease, they can appear in series. So these things aren't clear, are they? It's not always easy and clear cut. But notwithstanding that, there are some differences. So why all the confusion? How has Kawasaki disease got dragged into this?
I think it's been, a rather clumsy use of the term. It could easily have been described as measles-like or infection-like. It's unfortunate that the term Kawasaki-like was chosen, because it's really not a helpful term and only serves to confuse, in my opinion, and indeed has confused. I remain rather agnostic because, as I mentioned, Kawasaki is a great mystery in pediatrics. The fact of the matter is that COVID-19 might be one of those things that could trigger a Kawasaki response, but we just don't know. So it's too early to have made that jump between COVID-19 and Kawasaki disease.
So you've talked a little bit about the fact that we don't know what causes Kawasaki disease. Kawasaki disease isn't well known, even though it's increasingly common. So parents, carers, doctors need to know it. How would you summarise the symptoms of Kawasaki disease?
Children with a prolonged fever lasting more than a few days really should be considered as possibly having Kawasaki disease until proven otherwise. There are, of course, many other features: rash and swollen lymph glands in the neck, redness of the palms and the soles with subsequent peeling that can be diagnostic clues, red lips, red mouth. These are all the external features that can point to the diagnosis. One very important point is that all of these features may not be present at any one time. In other words, these features can creep up sequentially, and in retrospect, the diagnosis is clear when one begins to think about it. The particularly high-risk group are very young children under the age of 1 or 12 months. They can present with really minimal symptoms, may only be a fever. So as a rule of thumb, any young child or infant with a fever longer than 5 days should have Kawasaki disease at least considered.
Okay, so there's quite a number of symptoms that can occur in Kawasaki disease, but you've suggested there that they don't all have to be present. I know that we talk about persistent fever plus 2 of that symptom group. Patients should, or children should be considered for Kawasaki disease. But that's a really important point about tiny babies, isn't it? Because am I right in thinking they are most at risk of heart damage?
Yeah, the epidemiological studies that have been undertaken in the UK and in Europe and America and Japan consistently identify the youngest children being at highest risk. It may be because diagnosis is delayed for the reasons that we've discussed. In other words, not all the clinical features are present in that very young age group, resulting in worse outcomes for those children. Or it may be that there are other as yet undefined reasons that if you develop Kawasaki disease when you're much younger, you have a more severe variety of it. We just don't know the answer. But one thing that is clear is that children under the age of 1 seem to have a much more guarded prognosis. In other words, much more heart damage observed in some series up to 40% of children despite standard treatment for Kawasaki disease.
And that all sounds really worrying in terms of the implications for children, and we know it's the leading cause of acquired heart disease in children. Is it contagious?
It's not contagious. In fact, even though in the past there have been what appears to be mini epidemics of Kawasaki disease, you cannot catch Kawasaki disease from another human. There are many theories why that might be. In my practice as a pediatric rheumatologist, we're very aware of the concept of what's called auto-inflammation. In other words, the ability of the body to make bad inflammation even without an infection. So it's possible that Kawasaki disease is creating a set of inflammatory features that look like an infection, but it's often, in other words, not caused by an infection. Alternatively, it may be that there is a common infectious agent, that any one of many infections, that in most children only causes a cough or a cold, but in some individuals causes them to react in an abnormal immunological way, such that it's not passed from person to person like a true infection is, because you require the pre-required genetic priming in order for that to happen. So it's not contagious.
Okay, so I mentioned a number earlier, about 1,000 children admitted to hospital in the UK. And we've done quite a lot of research, as you know, and there's probably, if we take March, April and May as the period of the pandemic that we've been in, for the UK, if we look back at the last 2 or 3 years, probably should have been about 300 children affected by Kawasaki disease or into hospital with Kawasaki disease in this period. How does that compare with the number of children that are being affected by PIMS?
Well, at the moment, it's hard to be very definite. We know that the absolute number of PIMS has been rather small, actually, based on various European publications and emerging reports from Italy and from France. Overall, it's tens of patients rather than hundreds of patients. So we're talking about a very small number. And we know that this is happening at a time in the spring when episodes of Kawasaki disease can actually rise. We know that one of the curious things about Kawasaki disease is there's a definite seasonal variation. And this is true both in the northern and the southern hemisphere. In other words, during the winter and spring months, there are often peaks of Kawasaki disease. So without very detailed epidemiological studies and also case definitions, it's been very hard to differentiate whether this is a true spike or not. And time will tell.
And parents generally have been made very anxious, very worried about COVID-19 and the implications for children, having had a lot of really reassuring information early on that COVID-19 doesn't seem to affect children terribly seriously. This has obviously been put in the spotlight now, and a lot of people are worried. So in your opinion, do children get seriously unwell because of COVID-19?
No, the vast majority of children, this is based on data from around the world now, including the UK, have either no symptoms or a very mild illness. And we are talking really about a very, very small minority of children. So parents should be reassured. This is coming into sharp focus as the government and society considers returning to school. In my opinion, the default situation is that the children should feel safe to return to school with all the checks and measures that the government are hoping to put in place about social distancing, etc. So parents should be reassured.
And how serious, bear in mind that reassurance, how serious is COVID-19 if we compare it to other risks?
Well, it's in fact received a lot of attention. So in people's minds, it's the most serious threat to child health at the moment in people's minds. But the reality is that it's not. That there are many other things that can be detrimental to children's health: late presentations of cancer, other infections, other forms of pneumonia, other inflammatory diseases, for example, arthritis, inflammatory bowel disease. We've had appendicitis being mistaken for COVID. So the Royal College of Paediatrics have been rather concerned about inadvertent detriment to children's health because of COVID-19 due to so-called collateral damage. In other words, reduction in children's services in the NHS, delayed presentations because people are worried about going to hospital using public transport, etc., etc. So overall, the risk to children is very small from COVID-19.
It was certainly reassuring for me as a parent to read an article by a public health professional that identified children in England are more likely by a factor of 20-fold to die from flu. That's not something we hear of very often. And actually 70 times more likely to die from an unintentional injury than they are from COVID-19.
It's understandable that parents would be worried, particularly with these headlines and the coverage that's been issued, that if it's your child that gets this rare complication, it's no consolation that you're in a very small minority. So it's important that people are aware that it's not that there's no risk, but I think that as you mentioned, we have to have some perspective and understand the risk to children as compared to other medical problems such as unintentional injury, psychological morbidity, and other illnesses that we know still are affecting children.
And finally, Paul, this isn't the first time, is it, that Kawasaki disease has gotten dragged into a coronavirus conversation. Can you tell us a bit more about the history of this?
Well, I remember the last SARS epidemic in 2003 to 2004, and there were a flurry of case reports describing cases of Kawasaki disease with SARS-1 infection. And of course, because in some parts of the world, SARS-1 was rather more common, as is Kawasaki disease in those parts of the world, it's not surprising that some cases would be reported Kawasaki disease with SARS-1. Much more detailed epidemiological studies really rather showed that was not a major concern and that SARS-1 was not the cause of Kawasaki disease. And so I see a rather similar flurry of reports now appearing, and I remain curious about those and agnostic as to whether there could be a link, but at the moment the evidence is not showing that there's a direct link between SARS-CoV-2. We've kind of been there before, back in 2005.
Professor Paul Brogan, thank you very much indeed. It's been an incredibly informative interview, and I know both clinicians and mums, dads and carers all over the UK will be delighted to hear the phenomenal reassurance you've been able to provide. Thank you very much.
Thanks very much.